Good morning. Lotus Warnstein and I, Berthel Archie, are very pleased to invite you to this, our Fourth Friday Forum. Lodi is the president of the Alliance for Health, and I am the president and CEO for Nursing Care Professionals. So again, we really welcome you. This forum is sponsored by the Workforce Retention Network. It's a committee of Michigan Works. Our general mission statement is eliminating barriers to getting and keeping jobs. This forum emphasizes the fact that health and wellness is important and it is everyone's business. This forum takes on a skit theatrical format, and we trust that you will really enjoy what we have in store for you today. Lodi and I would like to thank the committee members who are Wynn Irwin, the chair of the Workforce Development Board, Dave Parker, myself, Amy Miller, Fritz Spritzer, Dan Wegge, Deb Vandermolen, Jan Keel, Laura Chris, Linda Joy, Vasquez, and Lodi as well, as I've already stated. There are others who are intricately involved. Christy, who does an extraordinary amount of work. She has toiled day and night to make sure that this come about, along with Lodi and myself. Our executive administration, Ms. Beverly Drake and Ms. Sylvia Hobson, are also people involved. We'd also like to acknowledge and thank all of the theater characters, and I will introduce them to you just a bit later. We wish to thank Spectrum Theater, Ms. Shelley Urbane and Mr. Tom for helping us with some of the props. Some general information for your comfort. Bathrooms are just outside the door to your right, both men and women. Healthy refreshments are on the breakfast table in the back. There's fruit, bran muffins, coffee, etc. The objectives for this particular session, this Fourth Friday session, is to discuss, role play a skit on how health and wellness impacts securing employment and productivity, and to raise awareness as to the reality of this simple drama that is occurring daily as we speak. You might say, when you see the skit, well, why are they doing this particular role playing, this skit? Even though it will be a simple message, we want to make sure you know what you see before your eyes is something that is occurring as we speak and daily. It is not make-believe. And we wanted to share information on health care resources available for dental, medical, and behavioral. We are specifically focusing in on the dental part because most people know where to get some level of medical intervention and maybe some behavioral health intervention. But when you ask the masses, where do you go to get dental health? They say, well, I really don't know. Lodi and I polled a number of people, and that's exactly what we got. The only time we got some direct responses were from people who are already involved in healthcare. They were able to tell us a few of the resources. And fourthly, in terms of the objective, we want you to just enjoy. If you see something that you'd like to snicker or laugh about, feel free. It's designed to try to not have this Fourth Friday Forum be boring, but be a bit entertaining, and at the same time to be educational. The characters that I'm going to introduce, we are the Commissioner, Jim White. He is a worker in the plant, and as you know, he is Third Ward City Commissioner. Dan Fogel, who is playing a role in the factory as well, and Dan is executive with 211. Mr. T.A. Alameen, he is the foreman in this particular drama, and he is a former executive with the neighborhood centers. And Ms. Roberta Wilkes, BSN RN, is a very fine registered nurse at St. Mary's Healthcare in management. And I think I said Dan. Okay, Dan, I would like to correct one of the things that I said. I indicated Dan was with 211, because I don't have those notes before me, but Mr. Dan Fogel is with, he is EAP, and a very, very important executive in that particular role. Let me just go on here. Yes, he is Robert McCown, excuse me, is the gentleman who is in administration with 211 United Way. And Miss Christy Gearing, she is with the Kent Plan. And so they will be able to introduce themselves to you a bit more completely later on, because after the short skit, they will assume their positions at the panel table so that they can talk to you a bit about their roles and also share with you information on their resources. The skit is aimed to show that it is important to have healthy workers versus unhealthy workers with a number of illnesses that impact one's personal lifestyle and impact securing employment and corporate productivity. Good health adds to the bottom line in terms of time and dollars. We demonstrate that something as simple as a worker having a toothache and not meeting minimum workloads is really an issue. At this point, I'd like to get directly into the narration. I will read just a bit on the narration to set the scene for you, and Lodi will follow, and it will be on. Good health and wellness are paramount to comfort, happiness, and one's ability to contribute to society in many ways. Health and wellness is everyone's business. It starts with oneself and proceeds to one's family, and then to others. Parents have the responsibility to promote health and wellness practices with their children. Adults, well, we are responsible for health for ourselves. It is important that we practice prevention. And then beyond that, yes, it is good to have insurance and know community resources to help us with other critical issues. In today's economy, not only in Michigan, but other states as well, all are struggling with skyrocketing healthcare costs, and an economy at times suffers. Here in Michigan, the automotive industry lays off many, many people, it seems like, every day, or make corporate adjustments that have the same results. However, there is significant growth in the health field. Just take a tour of our newly developed medical mile. Yes, there are going to be jobs, many, many jobs in health care.
Thank you, Berthale. I'm going to set the background a little statistically for you. We're going to talk about two things. One is people without insurance, and two is specifically dental health, which is something that we're going to portray today. In the United States, the current estimate is 46.6 million people are uninsured. That is about 16% of our population in this country. In looking at that, it's not uniform. For those of you in HR, when you're evaluating people, there is a racial component to those numbers. Almost 33% of the people without insurance are Hispanic. About 20% are African American, and about 11% are Caucasian. It's not the same throughout, and we have to be a little bit sensitive to that. Here in Michigan, we're a little better than some of the national averages on a percent basis. About 8% of our population in the state of Michigan is uninsured. That's about 800,000 people as of last year. The number goes up each year a bit more in the last several years. In Kent County, a conservative estimate is that 50,000 people do not have health insurance. So that's the scope of the problem, at least right in our own neighborhood. And it is not a matter of job status or whatever, because a significant number of people without insurance have members of the household who are working. 80% of the uninsured have somebody who is an adult in their household who's working, and of those, 73% were working at least 80 hours a week. So it's not a matter of working or not working, but there are uninsured individuals, a lot of different reasons. It's not necessary to point fingers. We all know health care is expensive. We all know that it's related to our business climate and so forth in terms of coverage. We all know that we're all responsible. We all know that we can all do some things. 1/3 of all health care costs can be attributed to two particular areas. One is overweight and the sedentary lifestyle that goes with it. The second is smoking. So about 1/3 of all of our expenses are right there. Now, when it comes to understanding that people don't have insurance, the dental area is one that comes to mind because for many people, dental is considered a luxury. It's a luxury unless you've got a dental problem. I think most of you have had toothaches. Let me give you just something that I don't think people normally are aware of. 3 out of every 4 adults have experienced periodontal diseases. 75%. 1/2 of all individuals from age 35 to 44 have periodontal disease. 1/2 of what you would consider that middle group in the workforce. There was a study that the American Dental Association conducted following a group of adults for a couple years. They found that of a group of adults, 42% have lost teeth. Of those, 14%, that was just in a short period of time, about a 3-year period that they tracked them. And of the 42% who had lost at least one tooth, 14% did not have them pulled in a dental office. They lost them somewhere other, home, workplace, wherever, but did their own extractions. It happens. So you've got people who think of dental as a luxury. Insurance is not uniform, and yet it occurs everywhere. So with that on incidents, I'll turn it back to Bertheo.
Thank you very much. And with that, we'll start the skit. And I got your permission a little bit earlier to adjust the time because of the weather, and the cameraman had not arrived. So just be so noted, we will be going to 9:30. Okay? It is on.
Your wife had insurance you could purchase, not dental insurance through your wife's work. I thought you were going to do that.
My wife ain't got no insurance. She work all day, every day. Ain't got nothing. They ain't giving you nothing no more. What are you talking about?
I'll tell you what, I can cover for you today, but I'm not going to be able to keep doing this every day.
Yeah, but man, this ain't getting worse.
Well, tell you what.
I think I got a fever or something.
Tell you what, I'll get you some aspirin. I'll be right back. Okay?
All right, man. Thanks. Oh. Oh,
Yes, can I help you?
Yeah, can I have some aspirin, please? My
Oh,
coworker is in
man.
pain.
Okay.
Thank you.
You want some water?
Yeah, that'd be great.
Mm.
Thank you very much.
You're welcome.
Oh,
Here you go. Just the aspirin, just some water, okay?
thank you, thank you. I didn't know you could do you like this, man.
Hey, I see the boss man coming. Come on, get up. Run. Start packing. Hello.
Yeah, all right.
We got to get this stuff out. T&W is not going to accept it. We can't fill the boxes.
We gonna get there, man.
Again.
We gonna get there.
We gotta have this
there.
stuff moved.
Don't worry about it.
Yes,
We
sir.
gonna get
Okay,
there.
we will get it
We're
over
gonna
to
get
the
them out.
top, and I've got to let you know.
Very
This is serious.
We're going to get them out. We're going to get these boxes out,
This is
okay?
a warning.
Okay.
Yeah, we getting there. We getting there. Oh, you gotta help me out. I can't cover this thing.
Okay, tell you
I
what.
gotta do something.
I think that's it for today. Okay, we'll come back tomorrow. You're going to feel better tomorrow.
All right.
I know you will.
All right. Oh.
Got up the sound, man.
Yeah. No, I got one more. I got one more. I don't think with my teeth. My brain. No, I'm all
Jenny, that's not a fair question to ask. Hey, hey, boss man, it's coming again. Hey, guy. Come on, hey, Jenny.
Come on. We gotta get this truck out. It's been going on for 2 weeks.
You gonna get it? You gonna get it?
Yeah, I know we're gonna get it, but we're not getting it. And I know Jake gonna get the job. Walter, I've been watching. John, you're the problem.
I'm sick, man.
She can help you out, maybe refer you to something. I'm sorry, it just won't work.
Oh,
Hi, how are you?
not good, not good.
How can I help you today?
Oh, I'm in pain. I just lost my job.
You lost.
Yeah.
Where are you having
yeah.
the pain at?
Oh, my whole side of my face. Oh.
And if you've got a problem with your tooth, you're not going to be able to get any dental care till we get that blood pressure under control. Let me look in your mouth here a minute. How many teeth you got? I see a couple. Which one is the one that's
I
falling?
got another one back here.
You do?
Yeah.
Are you? Is there any pus or anything coming out
It's
of there?
swollen. It's all swollen over here.
Okay. Well, I don't know where to get you any dental help, but I think you need to go to urgent care so you can get your blood pressure under control and get your temperature and stuff under control. Let me give you
You
some
got something for pain?
Well, I got some Tylenol here. Here, have a glass of water. Tomorrow, and I'll get you to find out about some dental resources. I'll get a hold of somebody and find out.
You don't know
there's-
where you can send me today. I
Today,
can't
I
wait
know.
till tomorrow. I didn't even sleep last night.
Even if I had a dentist for you to see today, he wouldn't take care of your tooth today because we got to get your blood pressure under control, get your fever down. Okay? So I want you to go to urgent care and get that taken care of. You come back tomorrow, I'll have some dental resources.
All right. All right. Oh. Oh.
I'm going to have to call somebody. Hello, is this Spectrum?
John, nice to meet you.
Yeah, nice to meet you. Okay, hi.
We pack them up and then we pass them on and they get shipped out.
Okay, I'm going to do this. I bet I can beat you, Walter.
Yeah, in your dreams. In your
I'm
dreams.
going to like this job.
Yeah, you're probably worked out, but wow, wonder whatever happened to John, you know. He had such bad teeth and it's got in the way of him being able to do his work, and I wanted to help him, but I just had no idea where to send him. Oh, I think the boss man is coming by.
Okay,
Get
well,
busy.
I'm
Get
going
busy.
to,
Wow! You guys are doing the job.
Yeah, we're
All right,
fine.
101 boxes? We surpassed quota. Great. Look, I've got some spiffs
That's
for
good
you.
compared to me.
Yeah, I like you. We got some spiffs.
Yeah.
How about we give you guys some gift certificates? Take your spouses out on us.
That sounds
You're doing a
great.
great job. Keep it going. All right.
Okay. Hey, Tom. Good work.
Good work.
And at this time, Ms. Winthrop and the nurse convenes an in-service. They're going to participate in the panel as well as share some educational information. So, Ms. Winthrop, you're asking people to now assemble at the table. If you'd like, you may assemble over here or here if you'd like. If you'd like. We'd like all of the participants to come join us. If you can bring your chairs. At this time, what will occur is that they've gone through the skit and they have depicted some very important issues. And I trust and hope that you enjoyed the drama. Now they're going to go into a little bit of a formal role, and they will talk about resources that are available for dental health as well as for behavioral health as well as for medical. And so we have some very able, gifted persons with us this morning. And while earlier I kind of mixed up Dan and Bob, this time I will not do that. I would like to say Mr. Robert McCown is sitting here as the director for the 211 program with United Way. And Mr. Dan Fogel is the director of the Employee Assistance Center. They're able and capable gentlemen. And to his right is Ms. Christy Gearing, program manager working with the Kent Health Plan. And then to her right is Mr. T.A. Alameen, former director of the Neighborhood Health Services. And then to his right, okay, is, well, you're all my friends, is Miss Roberta Wilkes, who is she's a registered nurse. She's the care coordinator at St. Mary's Healthcare. And then to her right is our own Third Ward City Commissioner, Mr. James White. And they have all done an excellent job with depicting this particular skit. Did you say so? And so at this time, you may have the opportunity to ask questions. Before we have them respond to formal questions, we're going to have each one go around the table and talk about their role a little.
Hear the microphone.
Okay. We'll just start with Robert and Bob, and just talk about your role, what you played. You know, you played an ADHD person, and you had some characteristics that you demonstrated. However, maybe you found a niche. You can talk about your niche.
I think I was Tom, and I think I found my niche packing boxes. Yeah, I was supposed to portray somebody who
had some impulse control issues as a result of attention deficit, that had some difficulty getting employment, and I think the HR person noticed that, but still gave me a job anyways.
Yeah, as John's coworker, I really felt bad for him, but I was willing to help him out to some extent, but I didn't want to lose my job because of his inability to be able to do what he was supposed to do. And I really would have liked to help him out, but I didn't know where to send him for dental care, and I thought he was getting it through his wife's insurance, but he couldn't afford it. But then Tom comes in, and Tom's working well, and we get our gift certificate, and I think the sad part is it's out of sight, out of mind. John's no longer here. We've moved on. I've got a new coworker. The company's got a new employee. John's still got a toothache, and not only does he have a toothache, now he doesn't have a job. So it remains very difficult for John, even though our life goes back to normal, and it becomes John's problem, his family's problem, or society's problem, or 211's problem. It's no longer the company's problem, and it's no longer my problem because he's not there anymore.
And I was Jenny in one role. The other role, I was the HR person, Miss Winthrop. And I guess I was kind of showing what a lot of people think, that if someone has a health problem, that it could be their own fault, and why aren't they doing something about it, and not understanding that they've been trying to, but there's not resources for them, and they don't know where to go. And also, I guess that's probably it. As the HR director, I did notice that Tom had some problems, but I thought I would give him a chance because he looked like he had a lot of energy, so that's what we needed, someone who would be able to work. So.
Morning. And I was Brad, and I was the first level supervisor, and that's the one who has to deliver most of the bad news to the workers. And being firm and being resolute and not even considering that he had personal issues, the dental as well as the family issues and what's going to happen after the fact. From stuff coming down to me, I had no choice but to terminate. And these are the things that our supervisors, our line supervisors, have to go through on a regular basis, even though they may not want to do some of these things because they understand the conditions out there. If there's no help available, we lose a lot of people that way.
And I'm Roberta Wilkes, and I played the nurse Wendy. And I've been in healthcare for most of my life, and I've worked in the emergency department at St. Mary's for quite a number of years also. And I know that that dental care is a major problem, and health care is a major problem when you don't have insurance. And what happens with a lot of clients is that they develop a little problem, and we're all guilty of this. We all think, well, it's going to go away, it's going to get better, it's not going to get worse, I'm not going to, I don't have the money, I don't have the time, I don't have the resource, and you let it go, whether it's, a sore on your foot or whether it's a bad tooth or an earache or whatever. And oftentimes the stuff that gets let go, it gets worse to the point where now it really turns out to be a catastrophic problem, because in John's particular case, we depicted that he had high blood pressure, he had a fever, and the dental community that I'm aware of won't treat you if you have out of control vital signs or high blood pressure or untreated medical conditions, because there's a liability there for treating somebody, only treating a piece of someone. So they really do want, the dental community really does want people to get their health care under control so that they can take care of their teeth. And for most patients, if you have a bad infection, all people want is their tooth out, when really what they need would be, may be antibiotics. And so you get the blood pressure under control, you get the antibiotics, get the tooth calmed down, and then you can get the dental care you need.
Yeah, one of the things I think is important is that I think you tend to, if you're not a medical professional, to think that the teeth are not important. I remember I actually did have an abscess once, and the doctors took my blood count, and it was off. And nobody could figure out why it was off, and it stayed off until the pain hit me. And they said, oh, let's look in your mouth. And they found I had an abscess tooth, and that was causing the blood count to be off. And so it's significant, and I just think that there are just so many people in this situation where they're simply not covered, and there's nowhere to turn for them.
If I can, I'm going to ask some of our panelists to share a bit of the resource. It's one question or one thing to know there's a problem, and it's pretty easy to be able to point at problems. Solutions are a little different, and we have some people who have solutions, but there are different solutions at different levels. Bob McCown with 211 has to respond to individual emergencies. Calls from individuals for service. Everybody has people at plants who have problems. Not all plants have insurance. Not all those with insurance have dental insurance. There are a lot of different things. Bob might be able to speak about some of the real concerns that are out there and the help that 211, which is sponsored by the United Way, can bring. Dan, with an EAP, or Employee Assistance Program, is on contract to workplaces to help run through and solve some of the problems that are there. And part of his job is to look beyond the individual to see what's really behind him and to understand that some people who might not otherwise seem appropriate for a job can really be, as in the case of the attention deficit case, where there's some things that might be distracting, but other jobs would be beautiful. Christy, as the program manager with the Kent Health Plan, has available to her a range of very low-cost health insurance products for people who don't have insurance otherwise, and the Kent Health Plan was formed for that. It is a tremendous resource for the community. Roberta is, as a care manager, right on the front line. And you understand that, in effect, there are real people, real problems, and you can't always touch the problem. You have to go into it a lot deeper. And then we have our good commissioner. And I'm going to pose a question to him, and then I'm going to run out of here because it's a loaded question. We do have, as I said, in our community, about 50,000 people who don't have insurance. What's the responsibility of our public sector in that, at the local level, the state level, and so forth? Who's responsible? Is anybody responsible? And before I leave you, I'll just point out that just because you don't have insurance doesn't mean you won't get care. But it does usually mean that you'll get care late. It usually means you'll get care when it's more expensive than if you can take care of it up front. And the question is this the way to run a railroad? So I'm going to leave that on the panel. We'll start with Commissioner White and work our way back.
Thank you very much, Lodi. I think that you're 100% right. There are a number of issues. We will be voting on a resolution with respect to the Iraq War, and some people say, what is a city commission even considering that? Why? Well, the reason is that the funds that we need to do a lot of things have been reduced to such an extent that we are fundamentally in debt. We have a big hole in our budget, and all of that starts at the federal level, it hits the state level, and then it hits us. So that's an issue. There's another policy or public policy question. When the government says something is for poor people, that is to say it's a poverty program, it has no political clout, and it is always, in my opinion, inadequate. So we have to, as public officials and as policymakers, get to the point where we see that health care is not just for poor people, it's for everybody. Then everybody is included in the discussion. And then you have something that's real, it's lasting, it has political strength. As long as we set eligibility guidelines that are so low that the only people who qualify for whatever the service is are very poor people, it will never have clout. That's what happened to the war on poverty. They were poverty programs. That is to say, temporary. Health care is a right for everybody, and everybody has to participate and see it as a need, and we have to adjust our policies and our laws to make that possible.
And I would like to expand on that by saying that in order for all of that to take place, in nursing we always say 3 words, and it's the same word: educate, educate, educate. When people aren't aware of what the programs are that are out there, they can't access them. If they don't know where to go or who to call, there's many people in this community that have a language barrier. I have a gentleman right now who has no Medicare B, so he has no outpatient services, and I believe it was a language barrier situation. He didn't understand that he needed to pay for that, so he would have, coverage for doctor visits and outpatient stuff. And I just think that, any program that gets put together that's going to help our community, we just have to educate, 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 because if people don't know what's available and if people don't know how to access it, that's going to be the major problem. And healthcare delivery, it's going to be changing over the next many years with the development of all the buildings up on Michigan Avenue and all Michigan State coming to the community and so forth. I'm hoping that we'll see some new avenues for people to get care. I know that I think that the University of Michigan has a dental program that you can go to if you have low income, but that doesn't help us because it's in Ann Arbor. And maybe if there's something like that that will be coming with Michigan State, maybe that would be very helpful.
Yes, I'm speaking from sort of a historical perspective. I was involved with neighborhood health services from 1968 to 1975, and we established clinics, treatment clinics, health and dental, in the complexes, West Side, Sheldon, Franklin Hall, and Northeast. And that was where people could get the emergency care, the indigent could get the care, and we had volunteer dentists. And that worked. I was involved, like I said, for about 7 years. And here we are, 30 years later, and we're dealing with the same issues.
Same model. It's the same model.
So somewhere along the line, we've got to step up. We've got to get the people who make the decisions that we send to make decisions for us to put health care somewhere near the top. I know infrastructure is important. I know that international issues are important. I know the economic issues are important. Fuel supplies, that's important. But the health care of the worker that's going to produce the products and stuff that helps build and keep the economy going, it's important. So we've got to make sure we have healthy workers. We've got to do all we can to make sure people have access. And I believe that lack of access is what's really caused the downturn. That's where our efforts have to be, in my view.
As Lodi said, I work for Kent Health Plan, and we are trying to address some of the need. We probably only have capacity for about 6,000 to 7,000 people at any given time among our 4 programs. And one of them is for very low-income people, and the state opens and closes that. It's been closed for a long time, but it's opening December 1st. So we are going to be trying to do some outreach, and I've informed people at the clinics who help their patients apply and also sent out information to a lot of community agencies about that. Our Plan B is basically for the low-income working people, and that one is closed right now. We're hoping to be able to open again in February. And we have Plan C, which is for small business, for the employees of small business, and it's a 3-share program where Kent Health Plan, the employer, and the employee all pay $67 a month for an insurance product. Our other programs are actually coverage. They're not technically insurance. We also have the medication assistance program, and that's open right now. It has a little bit of a higher income limit. I think for a single person it goes up to about $20,000. And it covers the same medications as Plan B would. So while we're closed, a lot of people may be going to a clinic on a sliding scale, but they're able to get their medication with Kent Health Plan's medication assistance program. And all of that information is at our website. It's www.kenthealthplan.org. And also, I get a lot of calls from people in the community who need resources. And one of the dental ones that I refer them to is the adult dental program. And the phone number for that is 776-2373. And basically they have dentists who volunteered to see patients. And the patients do pay a certain amount of the fee, and I think that it's based on their income. But the dentists really wanted to be involved to help these people get their problems taken care of so that they could get back in the workforce. So that's one thing that I refer a lot of people to.
Yeah, as Lodi mentioned, the organization I work for contracts with employers. We work with over 200 West Michigan employers to provide counseling programs for their employees. The cost to the employee is nothing. There's no co-pays, no deductibles. Two of the biggest barriers to people getting the counseling help they need are cost and not knowing where to go. Well, there is no cost, and they call our office, and we have a number of offices throughout the area where the person is directed to be seen. And there's other employee assistance programs in addition to ours that cover many more employers in the West Michigan area. Why would a counseling program be important in a situation like this? Well, it appears that there's financial reasons why John doesn't have dental coverage, but then you have to think, okay, well, John's working, his wife's working, they still don't have the coverage. Well, it could be because there's high co-pays and deductibles. It could be because they're in a waiting period. I know one large employer in the area, you have to work there for a year before you get any benefits. Or you may be a part-time employee, and therefore you don't have benefits. But we would look at a situation like this and say, okay, what's happening financially? What resources might be available to help out with the financial end of things? 211 through United Way would certainly be something we would think about. There's nonprofit credit counseling programs that are available to employees or to the whole public at no cost, which are available as well. But we'd look at, well, is possibly the situation where John is overextended because he's supporting he and his wife are supporting a family member, which is warranted under the situation, or maybe there's a family member who is draining their resources and really should be more in a position to be taking care of himself or herself. We'd be looking at, might there be a substance abuse issue? Might there be a gambling problem that's underlying this? Or is it possibly depression? Some people are so depressed that they just don't have the energy to take care of themselves. They don't feel like taking care of themselves. And that's the reason why he's not getting the dental care that he needs. Is he a Vietnam or a Gulf War vet who has experienced post-traumatic stress, and that's impacting him? And so we look underneath it, and is it a financial issue, or what is contributing to the financial issue? And we would work with him on that level. It's also important whenever there's an employee assistance program available to employees, we have a relationship with John, whether he has contacted us or not, because we work with the company. Company has contracted with us. John calls us. We don't turn John away and saying, we don't know who you are, we can't help you. It's, you call us, well, we have a commitment, a contractual commitment, and a moral commitment to work with you and to help you figure out what you need. And again, the barriers that people typically have to not getting help is not knowing where to go and the cost factors. If someone has an employee assistance program, we're able to cut through both those and get to what's underlying the problem and use resources in the community in addition to our counseling program.
I'm Bob McCown with United Way's 2-in-1 program. We're an information and referral program that has existed in this community since 1964. About 5 years ago, we started using as our primary phone number the 3 easy to remember digits, 211. And we responded to over 65,000 calls last year. Many of them are related to health care, and I think that the panelists have described many of the programs and services in the community, particularly for those who don't have coverage. And those programs clearly do a very valiant effort to try to address the gaps, particularly for those people who do not have insurance. some of the issues that we hear about is increasing co-pays for even folks who are working. It creates a barrier to accessing services as the co-pays increase. There are also frequently not equal access. You might be able to get access to dental care, but it's not going to be the same as someone who has coverage. You know, I think about my daughter this summer. She's a college student, you know, and I tried to coach her. She thought she was beginning to have some problems with her wisdom teeth. And I said, "Oh, you're off during this summer. Great time to get it taken care of." Of course, she waited till just before school started, and then it was painful. But the difference between her experience and the experience of many of our callers is that our dentist referred her to an oral surgeon, and within about 5 days, she was in and had those wisdom teeth removed. Frequently, what we're hearing from our callers is that if it's an urgent dental problem, they're not a regular patient of, for example, Cherry Street, they may be able to get in, but they arrive there several hours before Cherry Street opens and hope that they will be at the front of the line to get in. And if on Monday they don't get in, they're there then early again Tuesday morning. And maybe they're back Wednesday morning. And, you know, folks will ask us, is that fair? And, you know, I mean, Cherry Street isn't trying to be unfair to people. It's just the way it is. It's the reality. And I think, you know, I think that Christy also mentioned, you know, that they have capacity limits for their programs. I think the Thanksgiving wishes, if you read those in the Grandpa's Press, they came out on Thanksgiving Day. There were, I think, over 200 requests in a whole range of things, from basic needs to holiday gifts. But there's always a section of folks particularly wanting reconstructive work for dentistry. And I think that, you know, we've heard from some dentists in the community, it's offensive, it makes it look like they don't contribute. But I think it reflects people's real experience. They don't always know where to turn, and even if they do, the services may not address restoring the teeth. It may be focused towards extracting the tooth that is creating the pain. And that can affect a person getting a job as well, I would expect. You know, I think if you're looking at 5 employees and you have one or potential employees in one position, could the fact that somebody has a whole set of teeth and somebody doesn't affect your decision? I would think it would affect it. And, you know, we again hear from our callers who will say, I think this is happening to me. Who's going to get my teeth restored? And I don't think there's always a clear answer for that, and it reflects the gaps. And, you know, sometimes we hear from folks, well, it's real expensive to have that type of care provided. But what are the other expenses beyond health care? What are the other costs? And many times I think that our 2-on-1 team thinks, boy, if we could just get the preventative work, if we could get the initial work done early for folks, it would prevent all those other costs later on.
This was excellent input, just excellent information, and I appreciate this so very much. Are there other resources other than, Christy, you mentioned that Kent Plan, you know, there's a number to call, and Bob, you mentioned Cherry Street. Are there other resources for dental health? Because, you know, we know that there are a few more resources for medical and behavioral, and also, Dan, if you would highlight a little bit more, where can they get behavioral health? Okay, I'm going to pass the mic back and let you all give more input on dental resources if you know of any, and Dan, speak on that as well, plus behavioral.
Well, first, Christy may want to address, she mentioned the adult dental program through the county's dental society.
Yeah, that program, it's actually also run by a person who is housed at Cherry Street's Ferguson Clinic. And they do restorative work. That's really what they do. So it's not just cleanings and exams. It's for people who are missing teeth or need other procedures done. So that is one program that we refer a lot of people to. Also, I have referred people to community college for the preventative care. And I do have a phone number for that, too. That's 234-4237. And the last that I knew, it was $20 for cleaning, bite wing, and topical fluoride, and then $5 for sealant. So that is also a good resource. And
program, the dental hygienist, the folks who are in their dental hygiene program provide cleaning and assessments under the supervision of their professors.
I've actually had my teeth cleaned in that clinic because my daughter-in-law was a dental hygienist here a number of years ago, and she kept saying, I need another client. And I'd say, well, you can clean I've cleaned your teeth enough. I can't clean them anymore. So it is a very good program.
And so, Dan, would you speak on the behavioral, and Roberta, would you also share a little bit more about strategies, if you think of some strategies in the workplace that, if in doubt, can you come to?
For behavioral health, I think first question I would ask, is the person covered under an employee assistance program? And employee assistance programs don't just cover the employee, they cover the employee, they cover the spouse, they cover children, significant others living in the household. So even though the person's not employed, they may be covered under an employee assistance program, in which case they're going to get the counseling with no co-pays, no deductibles. Next question I would ask is the person covered under a medical plan for counseling? And if they are, then they need to contact the medical plan, because medical plans have their network of approved providers, and if you don't go through your medical plan and you see a counselor and you haven't gotten pre-approval, then you're not going to have it covered. So you need to contact your medical plan and find out who is within their network, and they can then direct you to one of those counselors. If you don't have insurance coverage, you don't have an employee assistance program, then I suggest people contact Network 180, which is Community Mental Health, and they have funds available to support people in counseling. They'll refer you to a counselor, and then there could be a sliding scale that would kick in if you are employed. So just because you're employed doesn't mean you can't make use of Network 180, and those are public funds that support mental health, behavioral health in our community.
Great. So, Roberta, did you want to speak? And then I'd like to ask Mr. T.A. Elamine to talk a little bit about what he sees in the community. He's involved with a number of programs, and I know that we both know Macaroni, who didn't have teeth for a long time, remember? And I know he talked about this himself, and he's not a client, but he will tell you he needed teeth for a very long time. So if you would comment on the prevalence of this problem in the community, or people that just need health care, period.
Well, I know that in the emergency department at St. Mary's, they have a list of all the dental clinics in the area, and I don't have that with me, but if you present to the emergency department at St. Mary's with a dental problem, if they don't take care of your, there's no dentist there, they're not going to pull any teeth or anything, but they will give you dental resources when you exit the department. And, it may even be that you would need medical insurance prior to needing the dental help. And currently, open enrollment for Medicare is November 15 to December 31, and a lot of people don't understand that. And even people that have just plain old Medicare A can get one of the Medicare D products simply by calling 1-800-MEDICARE or going online to Medicare.gov. And what you do is you put in your zip code and some other things, and it takes the million products down, and it keeps narrowing it down as you enter the information in that you need. So that's why I go back to what I said about educate. A lot of people don't understand that there is open enrollment, and I think that Medicare will have open enrollment every year, just like they do in the private sector.
That is true. Medicare Part D.
There's also an excellent program here in the community. Actually, it's part of a statewide network to assist older adults in understanding and some good choices about Medicare. It's the Medicare Medicaid Assistance Project over at the Area Agency on Aging. And the number there is 456-5664. And of course, for any of these phone numbers, we should be able to provide it if you simply call 211. If you didn't get the phone numbers down, we have all of this information.
One of the big issues is lack of knowledge of where to go, where to call. Even though 211 is big, I often run into people, I'm around the community, and I'm mostly inner city, that really have no idea. They don't know of 211. They don't really know what United Way does. They don't know, can't call for help or whatever it is. So the education piece that she mentioned is important. We've got to find a way to teach people what they can do, where they can go, who to call. Now, I'm looking at inner city because that's where I hang a lot and the people I run into. But we've got out-county locations, people in Sand Lake, Cedar Springs, Algoma Township, you name it. They don't have access, just like a lot of inner city residents. In fact, theirs may even be complicated by the distance they may have to go to try and get some help. So we have a county-wide, a region-wide, as well as a national problem. We've got to figure, I don't know how, but maybe we need to start talking to the school districts and put health back into the curriculum where we teach young people, because they may be able to go home and inform a parent or a grandparent, hey, you can go over here and get some help. You can go over here and get some help, because youngsters can be bearers of that message. So a three-pronged attack: the healthcare professionals, the outlets, the media outlets that get information out, and the schools where we can talk directly to the children and maybe they can take information home to parents. We've got pamphlets galore. You know, everywhere I go I see pamphlets. Maybe we can do something. Maybe with the elementary, they may take it home. The high school may throw it away. But the elementary, we can get information home to parents about where to go and how to access some of these resources. And whatever we do, we really need to do it now. Because the problem's festering.
I think there's another component to all this, and that's the wellness prevention end of things. If you look at vending machines in schools, if you look at vending machines in workplaces, if you walk around the corner here, you will see Skittles and all kinds of candy that is available. There are some employers and some school districts that are saying, no, we're going to provide healthy options in our vending machines. And some are even going so far as lower costs for the healthier options, higher costs for the unhealthy options. And we need that kind of mindset, and that's for general health, but it's for dental health as well. And if we don't have that mindset across the board, then my concern is that we're always going to be treating the problem after it arises rather than doing the prevention that we need to do to prevent this from occurring in the first place.
And Commissioner, would you close us up on the panel presentation, and we'll have an opportunity for a few questions from the audience. And we will bid you good morning.
Okay, well, I just think that this has been very, very helpful, informative to me as well. We live in an age where, in a certain sense, there's too much information. It's very hard to manage, and one of the important functions that I have begun to see is case management. You know, when you go to court, you have to have an attorney who's familiar with the system in order for you to have justice, because you don't know how to get that. I mean, we have people who are sent home from the hospitals because they do the procedure in the hospital, then you're out. You got to recuperate on your own. Well, I worked with an elderly man who had part of his stomach removed, and getting his insurance, getting everything in order was difficult for me. Now, this man had 2 years education, 2nd grade. And it was difficult for me to file the papers. I did it wrong the first time. I had to go back. So we're developing a culture where just getting what you're entitled to is becoming so complex that I'm sure people are missing out on a lot of things. So not only knowing about them, but having someone who can walk you through the process. I'm on the advisory committee for St. Mary's Hospital, and we've been looking at patient navigators, people who've been through the system and who can then help others get through. And you know, my wife is a registered nurse, over 30 years experience, but when she needed work on her foot, she didn't ask a doctor, she asked her sister who had work on her foot. So patients are referred by other patients, more so than by professionals. And so I'm an advocate of patient advocates or navigators who can help people through the system, because it is, in my opinion, formidable.
Excellent. Thank you very much. Thank you very, very much. At this time, questions, please, and we'll bring this to a close. Does anyone have a question? Yes. Stan.
I'm Ann Chu. I'm from Grand Rapids Public Schools. I had a thought while we were talking about dental care availability throughout our area. Is there any way to incentivize the dentists to participate in Medicaid, because it doesn't really cover their costs when they do have patients on Medicaid, and they are business people, and I know that we give tax breaks to other business people to stay in the community, and I just wondered if anybody had ever thought of incentivizing to make it to make the dentist able to help with this care. And the other thought I had while I was sitting here early in the morning, could companies come together and hire a dentist for their workers? Because I know there's people coming out of dent school who don't have the funds to set up their own practices or buy practices, but they could work for a few companies that came together to pay their salary to take care of the workers.
In areas where it is underserved by folks in medical practice, doctors, is to relieve that student of their medical school loans, relieve the student of their dental school loans if they agree to practice in an underserved area or serve an underserved target group. Might be a strategy. I mean, this is not my area of expertise, but I just took yours a step further.
That has been utilized in the past. In fact, when we had neighborhood health services, which preceded the Cherry Clinic, that was part of what we did. I hired 2 dentists to work with us, and of course we had federal and county funds, and that was their first job out of school. But they got their practice in, they got a chance to actually start building a practice and learning what they had to do in terms of practice. And the pay wasn't top end, but it was enough for them to start paying back the loans and take care of family while they built. So I think that's a good strategy. And if employers, we can get this word out to employers, maybe coming together, that could be a workable thing.
Yeah, my thought in terms of employers, if there were publicly funded dentists or dentists who were volunteering their time to do this, I think it'd be a great idea for employers to make that service available at the place of employment, so John could have gotten dental care at his employment. I don't think it's realistic right now that companies are going to spend money to pay for a dentist, even if it's done through a consortium, just given how tight budgets are in this West Michigan economy. I'd like to think it could happen, but realistically, I think the other option would be more viable.
See, one of the, you mentioned tax relief and so forth. One of the structural problems, and maybe we're changing it, is that our concept of taxation is based on property, but not services. See, dentistry would be a service, and because historically we tax things, property and equipment, so we can give, the city gives, we just did it on Tuesday night, we gave tax relief to a company that's taking over part of Steelcase's property in a building they're going to move in. So to encourage them, we were in competition with 14 other cities. To encourage them, we offered them that incentive, and they took it. But that was for all the equipment they got to put in there. Now, when we think about services, we haven't traditionally taxed services. So we'd have to find a way to give tax relief for dentistry, which is a service. And that's a change in thinking at the state level that Governor Granholm has introduced. But it's just getting off the ground, and it's not real popular.
I understand. The businesses, their buildings and parking lots. So
and equipment.
Right. That was what my thought was.
Okay. It's an excellent question, though, and I appreciate the response from the panel. At this time, it is the time that we stated we would close, and you've been such a wonderful audience in that you allowed us to make the adjustment. I don't want to keep you not even 30 seconds longer, so I do want to thank you immensely for coming. Let me give you the code to exit. 1234* is the parking code. I want to thank the performers, the panelists. Weren't they excellent? May we give them a round of applause? Thank our commissioner, James White, Mr. Dan Fogel, Mr. T.A. Elamine, Ms. Roberta Wilkes, who had to leave, the nurse, Ms. Christy Gearing, and Mr. Robert McCown. You were outstanding. I am very pleased to have had this opportunity to work with you on this. You were so, you know, when I asked them to participate and give of their time, they all just said yes. And I know the Lord is going to provide an extra blessing for each one of you. Really. Something you wanted is going to come, in my opinion. I want to thank Spectrum Theater for providing some props for us, Ms. Shelley Urbane and Mr. Tom. I want to thank President Juan Oliveras for permitting us to use GRCC Auditorium. And I want to thank Ms. Christy Graham, who is our staff, who works so diligently to make sure that things go well. And she just works very hard. And all of the committee members that I mentioned before. And I want to profusely thank you for coming out in this bad weather, because we think that some of the others probably changed their mind and you stuck to it. You came. And so with that, if there isn't anything else that I need to cover, is there, Christy? Except maybe I need to remind them that our next forum is January the 25th in 2008 on cultural awareness. And it will be here at the same place. And we invite you all to come back. And again, thank you so very, very much for participating with Lodi and I and the Workforce Retention Network. Thank you, and you're dismissed.